infection control and prevention management subject course, important topics, along with the page numbers. So initially, the structure of the infection control committee, who are like the chairperson, secretary, okay, all those structure you have to be clear about, okay. And then surveillance, definition of surveillance on page number 9. Healthcare associated infection definition, again page number 9. Read that, underline it as important. High risk areas, a list of high risk areas are given, okay, on page number 10. Read that. Standard precautions are on page number 14 and 15. Transmission based precautions are on page number 51 onwards. In between, you have all your PPE, okay, personal protective equipment, etc. So personal protective equipment, that is a self-study, okay. I guess who all are from the medical community, who all are from the hospital healthcare community, you already know what PPE are, okay. Just read it. The importance about important area about PPE topic is the sequence of donning and removing the PPE. Okay, that is most important, and which kind of mask, etc. And 95 when it is used, and 99 when it is used. Surgical mask, when should it be used? Okay, so all the rules, universal precautions under standard precautions, be very thorough about the statement. Okay, we can misinterpret the statement and ask you if it true or is it true or false. As soon as you see the statement, you will think it is true, but read it twice. Okay, read the statement twice. Okay, there may be some grammatical mistake or some misappropriation in the statement done. Read the statements properly twice or thrice before you answer it, specifically when it is a true or false question. Okay. Success rate of hand washing, certain percentages are given on page number 17. Please read that. Who should do, how, and when the hand washing should be done. Again, page number 17. Read that. 5 moments of hand washing, page number 19. Okay, we may invent new moments and keep it inside the 5 moments of hand washing. Such questions can come. You have to identify the bundle of 5 moments that are the correct one. Okay, so be very thorough about the 5 moments of hand washing. What is surgical hand washing? PPE, as I mentioned, the sequence of donning the PPE, removing the PPE on page number 29. Selecting a mask, in which occasion, in which circumstance you will choose which kind of mask. And 95 and 99 surgical mask, a table is given. Be thorough with that table. And the next page you will find a 95 mask on page number 48, about an entire paragraph and few points about a 95 mask is given. Read that properly. Then collection of blood samples, just read through it. Some points are given. Disposal of needles, how safe handling of needles are done. Page number 49 and 50. Isolation policy, very important. Some tricky questions will be asked from isolation policy chapter. Visitors policy, what are the responsibilities of the healthcare workers when you are staffed in isolation rooms? Okay, what are your policies towards the visitors? Okay, you have to be thorough. What health education you have to give to the visitors. Then hospital acquired infections, the entire chapter from page number 62 to 77. Everything is important. All the bundle of care for each type of hospital acquired infection is important. Then heating, ventilation, and air conditioning system. Okay, the air changes per hour, pressures. Okay, what is the function? What is the use of positive pressure isolation room? What is the use of negative pressure isolation room? Okay, so negative pressure rooms, positive pressure rooms, very important. Some tricky questions you can expect from these areas. Okay, tough questions you can expect from these areas. Then lighting, noise, the range of noise levels. Okay, the kind of lightings which can be used for specific procedures, general procedures. Okay, water, the amount of water required, water facilities required. Okay, cleaning, disinfection, and sterilization. All the tables, be thorough with that. Specifically when you are focusing on tables, not just for your theory exam, but also when you are practicing in real life, the infection control policies, when you are putting into practice, these tables will help you out. Okay, you will know exactly whatever equipment you have been handled in your hand, you can go and check in the table how you have to process the equipment. Processing means what? It's either cleaning, disinfecting, or sterilizing. Okay, types of different types of sterilizers, different types of disinfection, different types of cleaning. Okay, methods used, up to page number 113. Everything is important under this chapter. Okay, very important chapter. Then laundry, just read it, okay? Only conceptual questions will come. Tables and steps, only conceptual questions will come. Easy to answer. Housekeeping is also, just read through. Be very thorough about the zones. 4 zones are mentioned in the housekeeping. Be thorough with that. Then spillage, just go through the formulas and tables once. No need to by heart the formulas or tables. Just go through it once. Biomedical waste is another important chapter, from segregation to the last table, the classification of table which is given. Just study the classification table, which is the last image that is given in this particular chapter. Very important. Okay, if you can by heart that entire image, okay, the classification of biomedical waste management, you can deal with any kind of hospital waste management. You know what kind of treatment and disposal this waste is awaiting. Okay. CSSD, zones, important. Steps in CSSD. Occupational safety, just focus on the prophylaxis. What medication we can give, how can we treat any needlestick injury or any contact with all the cases. HIV, hepatitis, tuberculosis, measles, meningococcal meningitis, varicella. Okay, these are the only diseases which they have mentioned in the occupational safety of your textbook. Needlestick injury, the protocols, what you follow in your hospital may be slightly different from what is given in the textbook. So for your exam purpose, please stick to what protocols we have given in the textbook. Okay, for practicing, you can just follow what your hospital has asked you to follow. Okay. Then regarding SARS, 163 page number, SARS. Then antimicrobial stewardship, entire chapter is important. Do not miss any point. Okay. Tricky questions, tough questions, medium level questions can also come from antimicrobial stewardship class. Then outbreak investigation, steps and surveillance. Kitchen management, be thorough with the temperature. At what temperature milk has to be stored? At what temperature dry foods can be stored? At what temperature cooked food items should be stored? Okay, different kinds of storage which should be there in the hospital, kitchen and dietary department. Okay, what is the rules and regulations about healthcare safety which applies to handlers, food handlers? Okay, so these areas are important from kitchen management. So these are 2 sample questions from infection control, which is not a high risk area. Some options have been given. If you are thorough with the list of the high risk area from page number 10 of your infection control management textbook, you will find out ICU, OT and kitchen. Any infection can spread from these departments. Okay, definitely. Administration, there is no clinical activities there. So administration is not a high risk area. Okay, so that's the option. Administration is the right answer. Intermediate level disinfection, what does it do? If you're thorough with the chapter on disinfection, okay, intermediate level disinfection can only inactivate all microbial pathogen, but it cannot inactivate spores. Okay, it is completely useless for spores. So the second option is the correct answer. Okay, so these are the sample questions for infection control.